Welcome back. Moral hazard. Moral hazard. Give you a definition. You might have heard this in other disciplines. You might have heard this in other parts of economics. I'm going to give you a health econ definition, and we can talk more generally about what's the general definition. But moral hazard is going to be a situation in which consumers alter their behavior when insured against the true cost or the true risk. So in this class, we could also just say a simple version is that it's going to be a situation where consumers change their medical care consumption because they have insurance. Both of those are true. The second definition is a little bit more specific to the health econ class. The first one's a little bit more general. Now, we're going to have two types. We have something that is called something having to do with when your actions before the bad things happen, the risk, and things that you change after the bad thing happens, after you get sick. So ex ante moral hazard is going to be when you're doing things before the bad things happen that are simply because you're insured against the risk. So this might be something like taking fewer precautions because you know insurance will kick in. This is my sister when she was between jobs. Often when you change jobs, you have a couple months before your new insurance will kick in. So when you change a job, you might have a great employer with great insurance, but you actually don't get the insurance for a couple months. So you have this limbo that can be a little bit scary. So my sister, when she would change jobs, she would just stop rollerblading, right? Because if you fell while rollerblading and had to go to the hospital, it was going to be really expensive. And then as soon as the insurance kicked in again, then she would start rollerblading again. Taking fewer precautions. This might not be as much a problem in healthcare because there are other costs to breaking your leg than just the monetary cost. So even if insurance is covering the monetary cost, your leg still got broken. So that risk isn't being completely taken away. The financial risk is being taken away through insurance, but the physical risk isn't being taken away. So ex ante is a phenomenon that exists, but we might think that it's mitigated by some other rather important factors. The one we worry about a lot in terms of financing of healthcare is ex post. What is ex post? This might be that you will purchase more medical care than if you had been paying fully out of pocket. You can think of this happening two ways. One thing that often happens that we see is that after you hit the deductible and suddenly your insurance is very generous, you go out and get all of those elective surgeries you were thinking about doing, but you wouldn't have done that otherwise. The other way you might see this that was the important idea of the deductible and doesn't seem to be shaping out real well is you might not shop for care, right? If you think about this outside of simple healthcare, just think about it for your car, because we have moral hazard in cars too because you have insurance. If you have to pay for that ding in your fender yourself, you're going to shop around, right? Someone hit my bumper at daycare and they wrote me and they were a very upstanding citizen, waited for me to come back and said, okay, I'll cover it. And I was going to have to find someone to pay for it, and then he was going to have to pay for it through his insurance. Now, I don't really care if his insurance premiums go up, right? So do I have to search around? Lucky for him, there was another problem in my car that I had been meaning to take care of. And so I had some skin in the game. And when I was looking for someone to fix the dent he put in my fender, I also was paying for a scratch on the door. So I was shopping around for someone who would be cheaper. Lucky for that guy, because otherwise there would have been some pretty bad moral hazard. I just would have gone to the first guy that was convenient, even if they were more expensive, and he would have had to pay for it. Wah, wah, wah. So the other component could be that you don't shop around for cheaper prices because you aren't paying the full price anyway. That would be an ex post because the bad thing already happened, right? My car already got hit. What's my action afterwards? Ex ante would be, I don't park in that crowded daycare parking lot because I know that there's a really good chance someone will hit me. And if I have to pay for that out of pocket, I don't want to do it. But if I have insurance, I go ahead and just park a little closer so I don't have to carry the car seat. Those would be the two ways you would see this. And you can see as insurance coverage has increased in the United States, costs have also blown up because people aren't paying for it. And insurers don't have an incentive to keep the price down if consumers aren't going to walk away. Moral hazard.